Why do we get diabetes? Diabetes is a chronic condition that affects how your body turns food into energy. When you eat, your body breaks down food into sugar or glucose, which is then released into your bloodstream. The pancreas releases a hormone called insulin, which helps the glucose get into your cells to be used for energy. There are two main types of diabetes. Type 1 diabetes is an autoimmune condition where the immune system attacks and destroys the insulin-producing beta cells in the pancreas. This results in little to no insulin production. The exact cause is unknown, but genetic and environmental factors like viral infections might trigger this response. Type 2 diabetes occurs when your body becomes resistant to insulin or when the pancreas cannot produce enough insulin. It is often linked to lifestyle factors such as poor diet, lack of physical activity, and obesity. Genetics also play a role, and certain populations are more prone to developing type 2 diabetes. Other causes of diabetes include gestational diabetes, which occurs during pregnancy and usually resolves after childbirth, but it increases the risk of developing type 2 diabetes later in life. Prediabetes is a condition where blood sugar levels are higher than normal but not yet high enough to be diagnosed as type 2 diabetes. How to prevent diabetes? Preventing diabetes, especially type 2 diabetes, largely involves making healthy lifestyle choices. Healthy diet, focus on whole foods like vegetables, fruits, whole grains, and lean proteins. Limit your intake of processed foods, sugary snacks, and beverages. And remember to keep portion sizes in check to maintain a healthy weight. Regular physical activity. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, along with muscle strengthening exercises. Regular exercise helps your body use insulin more efficiently and keeps your weight in check. Maintain a healthy weight. If you're overweight, losing even 5 to 7% of your body weight can significantly reduce your risk of developing diabetes. Achieving and maintaining a healthy weight reduces the burden on your pancreas and helps regulate blood sugar levels. Regular health checkups are, well, super important. Get your blood sugar levels checked regularly, especially if you have risk factors like a family history of diabetes, obesity, or a sedentary lifestyle. Early detection of prediabetes can help prevent the progression to type 2 diabetes through lifestyle changes. Avoid tobacco and limit alcohol. Smoking and excessive alcohol consumption can increase your risk of diabetes as well as other health issues. It's really worth considering. Manage stress because chronic stress can affect your blood sugar levels and insulin sensitivity. Practice stress-reducing techniques like yoga, meditation, or deep breathing exercises. It can make a big difference. Diabetes is a chronic condition that affects millions of people worldwide. But did you know that while some risk factors for diabetes are beyond our control, many are directly linked to lifestyle choices we make every day? Understanding why diabetes occurs and how we can prevent it is crucial in managing and reducing our risk of developing this disease. Let's start with a basic understanding of diabetes. Diabetes is a condition that impacts how your body processes sugar, which is a vital source of energy. Normally, when you eat, your body converts food into glucose, which enters your bloodstream. Your pancreas then releases a hormone called insulin, which helps this glucose enter your cells where it can be used for energy. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune condition where the body mistakenly attacks the insulin-producing cells in the pancreas. This leads to little or no insulin production. Type 2 diabetes, which is more common, occurs when the body becomes resistant to insulin or the pancreas fails to produce enough insulin, while type 1 diabetes is usually diagnosed in children and young adults. Type 2 diabetes can develop at any age and is largely influenced by lifestyle factors. So why do we get diabetes? The exact cause of type 1 diabetes remains unclear, but it's believed to involve a combination of genetic and environmental factors. Type 2 diabetes, on the other hand, is closely linked to obesity, poor diet, and a lack of physical activity. It's also important to note that genetics play a role in both types, meaning if you have a family history of diabetes, you're at a higher risk. The good news is that type 2 diabetes can often be prevented or delayed with the right lifestyle choices. Here's how. First, focus on a healthy diet. Aim to eat a balanced diet rich in whole foods. Think vegetables, fruits, whole grains, and lean proteins. Limit your intake of processed foods, sugary snacks, and drinks. It's also important to watch your portion sizes, especially if you're trying to maintain or lose weight. Next, stay active. Regular physical activity is one of the most effective ways to prevent diabetes. Aim for at least 150 minutes of moderate aerobic exercise each week, such as brisk walking or cycling. Strength training is also beneficial as it helps your muscles use insulin more effectively. Third, maintain a healthy weight. If you're overweight, losing even a small percentage of your body weight can significantly reduce your risk of developing diabetes. This is because excess weight, particularly around the abdomen, increases insulin resistance, making it harder for your body to regulate blood sugar levels. Additionally, keep up with regular health checkups. Monitoring your blood sugar levels can help catch pre-diabetes early, which is a warning sign that diabetes could develop. If caught early, lifestyle changes can often prevent the progression to type 2 diabetes. Lastly, avoid tobacco use and limit alcohol consumption. Smoking increases your risk of diabetes as well as heart disease. Similarly, drinking alcohol in excess can lead to weight gain and increase your risk of diabetes. In summary, while diabetes is a serious condition, it is largely preventable through a healthy lifestyle. By making smart choices in our diet, staying active, maintaining a healthy weight, and monitoring our health regularly, we can reduce our risk of developing type 2 diabetes. Remember, small changes can lead to significant improvements in your health and well-being.